Healthcare facilities in KwaZulu-Natal suffered extensive damage after the deadly rains caused a trail of destruction in the province. At least 23 hospitals and 34 clinics were damaged, and repairs are likely to cost more than 180 million rand. The Health Minister, Dr. Joe Phaahla, has dispatched a team of national and provincial officials to assess the impact on services. And for more reaction on this, we're joined by the South African Medical Association board member, Dr. Akthar Hussainm. Thank you very much for availing yourself this morning, sir. What is it that some of your members have been reporting back to you in terms of the working conditions that they are faced with on the ground?
Thank you very much. Good morning, listener, News Africa. South Africa, this is the first time the serious disaster we have faced, flooding, especially in KwaZulu-Natal. And what happened, our medical doctors and other healthcare workers, the nurses and the paramedics, ambulance, they were severely affected. Those who are working in the hospital, they couldn't go back from the work. They have worked very long hours, despite there were no electricity, there were no clean water. Some areas was totally blockaged, damaged and flooded in the hospital. So only emergency operation theater was managed to run, but it was a very difficult situation. We have to cancel all the non-emergency medical operation. Then they were affected with the supply chain issues. They were not having electricity at all. Some hospitals didn't have water more than 24 hours. And that caused a lot of stress. While doctors are at work, their own home, their own house have been flooded, damaged and washed away. Some of them have to end up in the hotel. They couldn't stay in their house. And those who are at home, they couldn't come to the clinics or to the hospital because the roads are washed away. For example, in Umlazi, Rich Meshani, one of the regional big hospitals, the whole road is blocked. Containers are flooding on the road, so the doctors couldn't come, ambulance couldn't come out, and there were no earlier emergency disaster planning by the Department of Health to bring the doctor by the helicopters or some other method to take them back to the home because they were totally cut off from the family.
You speak of having to suspend non-emergency operations. Have you been able to conduct life-threatening, operations or operations that would possibly save people's lives?
Yes, the life-threatening operation were performed. Those emergency, somehow they managed, but it was big difficulties. And also, there are patients are coming like head injury, house fall down, the brick wall fell on their body, fractures, bleedings, and all those patients were treated. As far as the availability of the medication and the surgical ward to be open.
From the reports that you've received from some of your members, at what capacity are some of the hospitals and clinics that are open functioning?
Well, first few days it was working maybe 25%, 30% capacity. Basically, those who are there in the hospital, they have to run the service. And the following day, very few people managed to come. There were no access to come to the hospital. So it took more than 3-4 days for people to come back to get in normal situation to start working. Because the nurses' houses also affected. So it's not only the doctors, the whole healthcare system was affected. So initially, you can say very minimum level of work going on. And also first few days, the patients were not coming. But now, because some weather change, numbers of patients increase, lot of crowded area now, and they're coming with waterborne disease like dysentery, diarrhea, infection, drowning cases are also came. So now numbers are increasing, and it's a very difficult situation.
You've relayed stories of people having to walk, especially healthcare, doctors or nurses. You've also relayed stories of people who are worried about their own domiciles where they've also been impacted by the rains, yet still they go to work, yet still they want to help people. A lot of criticism has been leveled against the Department of Health or the health system in South Africa. But what does this tell us about our own healthcare practitioners, that in the face of this disaster, they too would risk their lives just to help other people?
Exactly, that is very true. We know our own doctor's house, 4 feet or 5 feet water, whole house is flooded. The doctor still went to the workplace to provide the emergency services. So when he come back, his own house is totally damaged. So there are many examples like that. And not only the public sector, even the private sector, doctors, clinic, surgery has been washed away and damaged. So for us, our patient is first, then on home and on health we have look after.
Dr. Akthar Hussainm, board member of the South African Medical Association, thank you very much for availing yourself this morning.